As I'm sure you know, therapeutic communication is essential for nursing practice to provide safe and effective and quality care. However, nursing students often struggle with therapeutic communication and find it very anxiety producing. Thus, as nurse educators, we really need to consider how to enhance therapeutic communication skill development. Generative AI technology is one new avenue that we have to help students practice therapeutic communication skills, and it can be less resource intensive than more traditional educational strategies such as standardized patient simulation, which is very resource intensive. So, the purpose of this study was to evaluate the impact of generative AI simulation on therapeutic communication skills of pre licensure nursing students. This was a convergent mixed methods design with two groups, an experimental group and a control group, and a total of 164 first year BSN students participated. The students in the control group engaged in what we would consider standard education, things like textbook readings, role play, audio visuals, and SP simulation. Individuals in the experimental group participated in standard education, plus they completed two simulation scenarios using a generative AI simulation platform called SimConverse. All students were evaluated on therapeutic communication skill at the completion or after they had gone through all of the educational modalities. And we found that students that participated in the generative AI simulations did, in fact, have higher therapeutic communication skills, but these findings were not statistically significant. We also collected some open-ended questions, responses from the experimental group to determine the students' perceptions of using generative AI simulation. And we came up with three themes. The students found the generative AI simulation to be very realistic, and they found it was a way to practice without pressure. So, practicing therapeutic communication in a low stakes environment was very beneficial to them. And lastly, they really appreciated the feedback that the generative AI program provided on their performance, and they actually desired more feedback, which was interesting. So, from a nursing education perspective, the findings from this study indicate that generative AI simulation is at least as good as SP simulation and can be used as an adjunct to traditional teaching methods and SP simulation. However, further research is warranted to determine if generative AI simulation might be able to replace SP simulation for therapeutic communication skill development. So future research is certainly needed in this area, including dose effect, so how much generative AI simulation is helpful, and looking at longitudinal studies, the retention of skill over time, as well as the transfer of skill into the clinical setting. Thank you very much.